B12, and the question is why. So the first question is, can excess intake actually cause very high levels of B12? And probably, because when you take a lot of B12, you can develop antibodies to transcobalamin 2. Those antibodies actually prolong the half-life of transcobalamin 2 in the serum. And this mostly happens with parenteral B12. So patients who are seeing a healthcare provider, hopefully a healthcare provider who for some reason is giving megadoses of B12 can actually get these elevated levels up this high. But the most concerning thing that happens is elevated B12 is also associated with hepatocellular tumors, either mets or primary tumors, and this is due to release of transcobalamin from damaged hepatocytes. So elevated B12 levels without supplemental introduction of B12 is not a good thing to have. And one of the things that we have to be concerned about are tumors of the liver, either primary or secondary. The other big thing that we have to think about is blood disorders, and myeloproliferative neoplasms are associated with elevated B12 levels. Okay, so that's important. Hypereosinophilic syndrome, acute myeloblastic leukemia, and this is because, again, you have the neutrophilic granules have an increase, they release transcobalamin 1 and 3. That's that transport protein. So when the transport protein goes up, the total B12 level actually goes up as well. You can also see this with alcoholism and liver disease, kidney failure, and any abnormalities in transcobalamin. So the take-home message is a surreptitious elevated B12 can be an ominous finding, actually. And it's something that probably requires investigation. Again, if somebody's getting high-dose parenteral B12, I think you have your answer. But otherwise, I think this really does deserve some investigation. But the question is can elevated B12 be toxic? Okay? I'm sorry. So this patient that I described, real patient, this is a peripheral smear. And what you see are granulocytes at various stages of maturation, and the granulocyte count is elevated, and this patient had chronic myelogenous leukemia, and that is one of the things that can cause an elevated B12 level because of an increase in these binding proteins that carry B12 around. So, can excess supplemental B12 be harmful? There's no tolerable upper intake level that's been determined. Again, excessive supplementation can induce some autoantibodies. There are allergies. And the only thing I was able to find is that if in patients that are given very high doses of B12 for unclear reasons, there is an increased incidence of acne and rosacea. So aside from skin findings, really this isn't toxic. It's excreted in the urine, but there's just no reason to give high doses of B12. We're going to talk about things like the common cold, etc. in a minute. Here we go. Aside from correcting deficiency, are there any reasons to give B12? So, you hear about this time of year, people getting B12 shots. Again, shots are probably not the right thing anyway, but to prevent the cold, there's absolutely no data that B12 prevents cold or flu, nor should it biochemically. People get B12 shots when they're fatigued, and one review concluded that ordering serum vitamin B12 to assess cobalamin deficiency among patients with unexplained fatigue was not cost-effective in any patient population. For patients with a pre-test prevalence above 1%, treating all with oral vitamin B12 supplements without testing was cost-effective, whereas watchful waiting was cost-effective in those that didn't have a high pre-test probability. So this B12 does not make you stronger, it doesn't make you run farther, it doesn't make you healthier. It is useful if you are deficient to replace, but aside from that, there's really little utility in giving B12 to patients with normal B12 levels. So the question is aside from correcting deficiency, what is a B12 shot good for? And the best answer I could find in the literature is about $145.88, which is the average charge through Medicare for giving a B12 shot. So anyway, the insurance companies know that they're not going to pay for this, and probably shouldn't in the vast majority of cases. Okay. Let's go to a different case. An 18-year-old college student presents with altered mental status, confusion, and hypertension after final exams. She was also noted to have pancytopenia with megaloblastic changes in an otherwise hypocellular marrow. Her laboratory studies show a hemoglobin of 8.7, an elevated MCV, low white count, and low platelets. So, my question for you, and we're going to do something fun. We're going to do analog audience response, okay? So the way this works is when I call it the right answer, you're going to raise your hand. Now let's make sure everyone's analog audience response works. On the count of 3, 1, 2, 3. Not working. Okay, good. Everyone's working. All right. So the question is, remember, this is a college student who's celebrating after finals and has every indication that she may be B12 deficient. So inhalation of which of the following could cause her findings? And I want you to raise your hand when you think it's the right answer. Toluene, amyl nitrate, cocaine, marijuana, nitrous oxide. Okay, the majority got that right. That's pretty cool to look at that. So the right answer here is nitrous oxide. So acute nitrous oxide ingestion can cause an acute megaloblastic anemia. And this is true for recreational use. Are there any anesthesiologists in the room? Yeah, have you ever, you don't give much nitrous anymore, but you know, anesthesia was first reported actually in the anesthesia literature, right? But now that it's used recreationally, we see this as well. And what happens is nitric oxide actually works at this part of the biochemistry. And nitrous oxide oxidizes the cobalt in B12 to its trivalent form, rendering methylcobalamin inactive. And you can see acute neurologic effects. You can see megaloblastosis, and we treat this with supplemental B12 and folate, right? Because what we want to do is we want to give the monovalent cobalt B12, which is actually the utilizable form. Okay? So acute nitrous oxide intoxication can do this.
Was that just acute because her crib was 26?
Yeah, it can happen. Well, let's say she's been doing it for a couple.
Yeah,
of years.
she's been sucking on.
Yeah, been doing it for a little bit. Good point. Good point. A 48-year-old woman with type 2 diabetes treated with metformin presented for evaluation of worsening macrocytic anemia for the past year. Over the past 12 months, her hemoglobin has gone from 12.6 to 7.8. Her MCV's increased. In addition to metformin, she's taken lisinopril, simvastatin, and aspirin. Her physical exam is unremarkable. Serum MMA is elevated. So she's B12 deficient. Which drug is doing this? Metformin, good. And that's really important because we have a lot of patients on metformin. And I see probably a couple of these patients a month almost now that are B12 deficient from metformin. It's something we need to actually look for. It's in the literature. It's associated with an increased risk, with a relative risk up to about 2.5. It's also been associated, perhaps not surprisingly, with cognitive decline and neuropathy. And what metformin does